Now we look at another issue that could actually occur around the hip region. Okay, the hip region, and this is tumors that could actually occur at the acetabular floor. Tumors of the acetabular floor. Okay, so you have a tumor and it's occurring around this place. That's the head of the femur, right? So it was corrected, and that whole part of the bone was cut out, and they actually they did a joint replacement for the surgery for the patient. Okay, tumor of the acetabular floor. Okay, so the whole femur bone is actually becoming cancerous. The best thing is actually to cut it out, and they put a metallic femur for you. Can you see how on x-rays the metals are actually so bright? You understand? So that's how they actually do this. Sorry, I'm just trying to write something down. I remember something I'm supposed to research on. So tumors of the acetabular floor, you should know that they are rare, but they are clinically significant tumors, and they affect the hip joint. And the hip joint is very important because it bears your weight. It's a hip joint that is bearing the weight of your head, your chest, your stomach. Everything is resting on your hip joints. Okay, so we have different tumors that could occur there: giant cell tumors, osteosarcomas, Ewing sarcomas, chondrosarcomas. They are different. Okay, so acetabular floor is the central part of the hip joint. Tumors here will compromise the joint stability. Okay, so different types of tumors that could occur there include all those things like chondrosarcoma, giant cell tumors, osteosarcomas, Ewing sarcomas, osteoid ostomas. They can also have tumors or cancers from other places spreading to this region. Cancers from the prostate spreading here, cancers from the breast spreading there, cancers from the kidneys spreading there, cancers from the lungs spreading there. So clinical presentation is there's a lot of pain, pain in the limb, restricted range of movement, there's swelling, tenderness, and sometimes palpable mass. Okay, it could lead to fractures because that part of the body is weakened, collapse of the acetabular roof, and secondary arthritis. So on x-rays you see a lot of lytic or sclerotic lesions, cortical destructions. Okay, CT scans and MRI will also show you extent of bone involvement, dictate multifocal or metastatic disease. Management is if it is benign, curettage, radiofrequency ablation, excision. If it is malignant, all those wide excision, reconstruction of the acetabulum or prosthesis or grafts. Okay, so adjuvant, that's where you now use all those chemotherapies, radiotherapies, palliative surgeries. Okay, cement augmentation or radiotherapy is just to relieve the pain and maintain mobility.